all of you followers, fans, and friends of the Story Warrior channel. I have some good news for you today. Somebody that I've been waiting to bring onto this channel for a long time is finally here. We know that we live very busy lives in diaspora, but do you know that there are unique Africans in diaspora who go far and beyond the call of duty? They don't just take care of themselves and their families, but they go back to the motherland to bring hope, to bring medical help to those who are severely in need. This afternoon, Dr. Samuel Dijankat is joining us on this platform to tell us an untold story. An untold story, which I believe is the story of an unsung hero who is trailblazing and doing work that very few would want to do. I classify him as one in a thousand African diaspora. So, very good afternoon, Dr. Dijankat. Welcome to the Story Warrior channel. How are you doing today, sir?
I'm doing great. Thank you, Dr. Gideon Pomokwe, for inviting me. It is really a pleasure for me to be here today. Thank you.
Absolutely. We're the ones that are delighted. We're privileged because during this time of the day, usually you'll be busy. Maybe you're helping or working out at the hospital, but you made the time to be with us. So I'm very honored that you come and share with us about some of the things that you're doing, not only here in America, but back home in Cameroon and in Africa at large. So in the last couple of weeks, I've been fortunate to learn a little bit about your organization that you co-founded with your wife. Tell us a little bit about how you founded Faith Gardens Medical Foundation.
Thank you very much, Dr. Gideon. Faith Gardens Medical Foundation was founded in March of 2013. It is a 501c not-for-profit organization with headquarters based in Dallas, Texas, in the United States. We, my wife and I started Faith Gardens Medical Foundation because we have the love to go back home being Cameroon, to help our brothers and sisters, to help our parents who are back home. We are all healthcare professionals. So we created Faith Gardens Medical Foundation with the purpose to lead medical missions to Cameroon and beyond, because we believe that there are many suffering from infectious diseases, chronic diseases that draw less attention to the Western world. And we said somebody has to take the lead. And so in March of 2013, we started Faith Gardens Medical Foundation International. We do have support from colleagues, medical doctors, pharmacists, nurses from Nigeria, Cameroon, and other countries. So that is how Faith Gardens came into existence.
Very interesting. So you found a problem, and not too many people were solving that problem. You and your wife said, if not us, then who? If not now, then when? That's basically how you founded this amazing organization that is going back and helping those in need. Did I get you very clearly that you said, I'm not going to wait for somebody else to do it? I want to be the one that will start doing it. Is that correct?
Yes, sir, you are right on point. We had a discussion. I want to appreciate those other founding board members who joined us. We have Dr. Raymond Quantabisa from Ghana. He is a neonatal intensive care physician. We have Marilyn Seymour, who is a pharmacist with me uh, at Children's Hospital in Dallas. Dr. Olomo, who is an anesthesiologist also in Dallas. We started and we were discussing, and we say, here we are all from Africa. We are doing everything. We know United States as the best in all technologies, but why not take all this back home? Africans are the one that can actually make a difference back home. And we embark on this trip with the mission that if we start this, we can encourage many others to go back home and to showcase our talents, the skills. What you are doing, this is wonderful, and I want to commend you and your team. And this is what we need in order to be able to showcase what many diasporans are doing. And for us, it was a no-brainer that we all come from Cameroon, specifically from the northwest region of Cameroon, from Bangolan in Dop, and that is where our mission is focused. But we have been to other areas in Cameroon to do medical missions.
That is very inspiring. You look at the circumstances and you said, someone has to do it, and it has to be me. That is truly how unsung heroes operate. They don't wait to get the limelight, they don't wait to get the CNN show up before they do something. They get out there and start solving a problem. So you started by conducting medical missions, and you had the support of your wife, you had the support of your professional colleagues at your professional organization in Dallas, Texas. And let me ask you this: when you started, what was the primary mission, or should I say vision, and has that changed over time? So first, take us back when you were doing the first mission. What was your vision?
The very first mission, the focus of the first mission was to go back to Cameroon, offer our services. And when we started this mission, it was not clear that we were going to build a hospital. And so as we got on the ground, uh, like you said, we teach our members and staff that we should be powerful. Powerful meaning that you should own a problem. We should not say, I cannot do this. I will not do this. You should find a solution to a problem. So during our first maiden medical mission in 2014, we had challenges actually collaborating with the district hospitals. And as we did the first mission, we started thinking about sustainability. We started thinking that we have been here, we've provided care, but now that we're gone, what is going to happen? Who is going to follow up? So we started doing some education, and the idea about actually building a mission hospital was born in 2014. And we quickly started doing some research, started putting all what we needed, inquiring from the authorities, what do we need in order to put this down together.
I can only imagine how enormous it is to build a medical facility overseas. Even if Cameroon or Africa is a motherland, if you're not living there, how do you start and implement or bring to fruition such an onerous task? Tell me, how could you first raise the funds and go out there and build? Because we know that you didn't just do that, you've accomplished that, and you're even exceeding bounds. But first, take us back to how challenging it was to build medical facilities in Africa.
Well, Dr. Gideon, thank you for that excellent question. You know, before even going into the question, like looking just the discouragement that we had because many have tried. And when we got into this and we would talk to our friends, doctors from Cameroon, the answer was, man, do not waste your time. We have tried, it cannot work. The corruption back home is so bad. And yes, of course, we knew all of that. And I have listened to that when you are on a mission, you are going to face a lot of obstacles. And there is a phrase that a bend in the road is not the end of the road. And we were inspired also that there are many who have almost succeeded. But if you almost, but you didn't make it, that will seem look like a failure. So as we went in, we did all our homework. The challenges were there. First of all, the obstacles were enormous. That was when we had Ebola, because if you remember, we started in 2013, 2015, Ebola came, and immediately we have COVID. And of course, you have the Northwest and the Southwest crisis in Cameroon. So now we're talking about Cameroon. You have all this going on, and it is during the time we were working on getting the hospital. Uh, we've had a lot of support. I will give credit, and we appreciate uh, His Excellency Professor Gogomo, His Excellency the Prime Minister of Cameroon at that time, his Philemon Yang, and we've had many other support. Those that we went to and said this country is tough. I will remember Senator Jinga Ignatius. I will remember Dr. Nick Nguanyam, who is a very good friend of mine. We've reached many people that I cannot mention. Even back into the United States, we were looking that, yes, we know it is tough, but what can we do to help our people? The road was tough. We had all information from the United States government. You cannot go into Cameroon. Also back home, you know, of course, the leaders in Cameroon, they don't care what you're coming to do. This is just being honest. I deal with the leaders all the time, and I've been commended by them. I mean, they've asked us, it is now that we can actually say it, that you are really resilient. That is the word that I have heard multiple times. Our envoys on the ground got tired. My family at some point gave up. And at some point, God inspired my wife, inspired me. And even no matter how treacherous the road was, my father-in-law, Reverend Dr. Donald DeCheffa, they have been very, very supportive, and with their prayers. Of course, we have our fund, His Royal Highness Senator from Chaffa. There are many on both sides that I can name. We had to trust in God in everything. We believe that without God, we wouldn't have done what we have done. So that's been the path to having Grace Gardens Hospital authorized, and the authorization came after the visit by the medical council, the Cameroon Medical Council, and it was on a special day to those of us from America. It was on July 4th, the Independence Day of America 2018, that we had a successful visit by the Cameroon Medical Council, thanks to the regional delegate of public health for the Norwest at that time, Dr. Manjong Matilda. So they've been many unsung heroes throughout our journey.
Fascinating insight. Mentioning those names, giving credit where it's due. I'm sure some of them showed up with goodwill. But what about raising the money to build the physical structure? Or did you have to go into your deep pockets, find money to build this? Or did you have some good funding agencies in the United States or other parts of the world? Tell us about raising the building, how expensive or how much you had to invest in that. Please take us behind the scenes.
Thank you very much. Thank you, Dr. Gideon. This project, I believe you can have, this is one part of it that I want to share. When you want to go for something, you need to understand that thing perfectly. So as a clinician, I decided to go in for my master in health administration with specialization in clinical practice management and with focus building a hospital back in Cameroon. I did not end there. I moved on to obtain a doctorate in health administration. Why am I bringing this before the money? Sometimes you can have money and you will not understand how to put it in use. There are many financial experts out there who might not understand exactly what we have done. And the number one challenges in terms of financing a project is that there are many projects out there and you cannot get it to those who can fund it. So that was the very first thing I got. And so what did I do? First of all, I took a loan for the primary care center, which was not enough. And because this project is so dear to me, this is something that it took my wife and I tough times. We used our retirement money of almost 28 years to commit on this for this project. Even when we got to Cameroon, we had information. Now, if you are doing this and spending that amount of money, you need to do it in a city like Douala, Yaoundé, where there are no crises. We said the purpose of this project was to give back. Yes, we want at the end, at some point, to also benefit from it, but we trust God and by faith embarked on this project. And I will tell you, up to this point, we have two buildings. We have the primary care center that costs almost $250,000. And then the surgical center, which at the end of completing the construction without including the medical equipment and medical supply, costs $300,000 to complete that building. And in the first phase, we do have some few friends who were founders that joined us to provide about 18% of that cost. And we really appreciate Gerard Cheney and Marilyn and their spouses, Fidelissimo and Luma. Those are the few partners we have for the phase one. And that is all. And what is the challenge there when you hear me talk about the financial expert? We cannot measure what we invest back in Africa because it is unknown. I mean, it is so challenging, but having this opportunity, I want to say we are the one that can develop Africa, and the price of it we cannot measure. You have to go by faith. And that is what we have done up to this point.
Wow. So that is moving, telling a testament of what it took from your own personal reserves and some contribution from well wishers to get things going. So you definitely have what some people call skin in the game. You believe in it so much so that you're willing to commit your own retirement resources to get it going. I cannot commend you enough. I can't find the words because I am not even the right party to talk about that. But what is so inspiring and moving about that is that you brought it to fruition, and that's in a part of the world and in a country where many have tried similar projects and failed. I know many people that lived here in the diaspora. They accomplish a lot. They work at top organizations. They put together all their resources and they went home, started investing in various kinds of services. And after 6 or 7 years, they packed everything and came back. I have multiple examples of that. So, what you're demonstrating or what you're telling us here is that not only did you build, you stayed to serve. So tell us about Grace Garden in DOP. What is its role? What is it providing in that part of the country which is currently going through civil war? Although some people want to mitigate it and call it a crisis. Heck no, it's not a crisis. It's a civil war. Tell us about running a hospital in an environment that is surrounded by civil war or civil conflict.
Thank you very much, Dr. Gideon from Mukwe. Thank you. That is, you are really right on with this question. And I want to tell you, when we started the medical mission, the way we funded medical mission was, for example, if Dr. Gideon is going, Dr. Gideon will pay his flight. We will have those who can give us the medication. And then, thank God, being a 501c, we write off at the end a tax deductible receipt. But of course, as I've already explained, when it got to building the hospital, you cannot ask those who are volunteering their time to go serve to also do that. Now, as we've already said, Grace Gardens is a structure where right now we have the primary care center offering primary care services from those coming in with simple wound, headaches, minor trauma, major trauma. Labor and delivery is number one in that department. We have the only blood bank in the whole district. The district hospital don't have any. So we're basically serving as a reference center. We have an eye department where we have a doctor that comes in from Bafusam every week to help the people. We have a cervical cancer screening program. This is one of a great program, and I want to talk a little bit about that. You will not believe that more than 85% of those who are diagnosed with cervical cancer in Cameroon, they will die, which means that less than 20% have access to screening. This is just that. Why is this so important? When we found out this, because my wife is a cervical cancer survivor, we got to Cameroon, we found out that 7 out of 10 in the Northwest region who are screened, this is basically a case story, will be are positive. And from our own little screening, which we did in 2021, we found we screened 200 women, and more than 33% of them had precancerous lesion. We went to Yaoundé at FECOM. These are professionals, and 29% of the women there had some kind of precancerous cell. I took that as a challenge, and we went on social media. We found, we got in touch with a doctor from Sweden. His name is Dr. Philip Goliath, and there's a company in Sweden. They have a mobile colposcope. This is just like a camera that will help a doctor to be able to magnify a lesion, and based on a medical score, can tell whether you are in the early stage. It's almost like a woman doing a mammogram where the X-ray can show that you have lump. So this colposcopy machine, we were able to afford one for $3,000, and we have Dr. Philip Goliath went to Cameroon last August and trained our doctors. So women in they have this blessing that they can go to Grace Garden and receive free screening. And of course, if you watch Dr. Paul Mogbitzer, who is an expert in cancer in Cameroon, there is a video that they have that cancer in general is more of a silent killer than heart attack. And many people are dying of it. And so we are taking a lead. Our mission is to be the leader in building healthcare community. So we are providing services in this area. Currently, we have 3 doctors, and we are training them. We are going to all villages in DOP. We are also treating sickle cell. Of course, the medication hydroxyurea, that is an important medication in Northwest and also in Fumban, the West region that is closer to us. They come far away to get this medication from us. And so those are the major services that we're providing. We have almost about 20 nurses working in our clinic, and a total of 55 staff that are there from 24/7. So we operate 3 shifts. We have a full day shift and evening and a night shift. And we have a solar panel, of course, like you mentioned, is a place of crisis, and we have a good water system for the team. When we started, can you imagine a woman delivering without water? So it has been a long road to where we are, and it is through that we actually got recognition from the Minister of Public Health, uh, Dr. Manawuda Malachi. And of course, we've been working in collaboration with the delegation and the district. Our goal is to lead and to bring all the health facility together, because the purpose is to rebuild hope through preventive and holistic healthcare. If we can educate our people to understand themselves very well, that will be very helpful. So that is basically, in a nutshell, the services we provide in that. It is challenging. It's very tough, but we are believing and trusting God. And of course, our values. We are very compassionate, teamwork, uh, excellence, and innovative. We believe that us, like I said at the beginning, my challenge to them is that do not wait for somebody else way to come and change you. You have to get to. Yes.
That incisive picture of what's happening on the ground, it's very encouraging and empowering. But I imagine that there are people in other parts of Canada who are getting very jealous. Let's say just within the Northwest region, there are dozens and dozens of other municipalities that are not as blessed as Ndop. So, what are you doing, either through the staff on site or through your outreach, through your connections with government authorities, to ensure that if somebody gets sick, say in Ikwa, somebody gets sick in Batibo, Bengui, Manso, you name it, in Fundong, they can understand that by coming to Grace Garden, they can get reliable cervical cancer protection or treatment for that matter.
Thank you very much. Thank you. We do have the challenges to reach out. Now we're on Facebook. We are also connected even through the Cameroon Town Hall, which brings medical doctors and other healthcare professionals both in diaspora and back home. This comes up every fortnight. We are on the ground working with the local media also. We have been even on Equinox. We are connected to the regional hospital in Bamenda. We are sending our communication and marketing team to reach out to all these areas and to let them know, especially for the sickle cell, that we are using evidence-based medicine. We can help all these patients and avoid crisis. So we are doing our best, but it's a work in progress. And I really appreciate having this opportunity to share with you today. We are looking for more different media where we can reach out. Right now, we've been recognized by the Ministry of Public Health and the Committee for Diaspora. We are also appointed. I was appointed as a member of that working group, and we are working with those in France, in Britain, and many other areas. And the goal is to get to a point where we are not duplicating what we are doing. We are working in synergy, which is to the point that somebody in Batibu, if they really know, can they reach out to us? And by the way, if you have a loved one in Cameroon, for example, with diabetes, Great Garden can help you, whether you are in 4 hour in Genicom, and we can get you your medication from US to your loved one in your village, no matter how far or wherever they are. So that's just to answer your question. So even this medication that we're talking about can get right to the doorstep of somebody who is invincible. With, and the follow-up, we go through Grace Gardens. We do Zoom every day. We can consult with them even through virtual telehealth. So those are some of the services that we're providing.
From what I'm hearing, you are not only serving the people in DOP, but you're bridging the gap, providing telehealth services. You're able to deliver medication straight out of US to those who may be in dire or desperate need. And in some small fashion, what I do on this channel here, the Story Warrior channel, is to tell the stories of true, committed, unsung heroes like you. Because it takes just one person to spark the light and shame the darkness. We're hoping in some way or shape or form, someone might benefit from this. Someone might pick a small sliver of this, admires it, and uses it to inspire another person to become that young person that takes medical studies seriously, or who shows up at the door of Grace Gardens to work as a nurse or to contribute in some shape or fashion. So we're trying to build bridges here. We're trying to provide those connections. But I was pleased to hear about the Cameroon Town Hall. I was pleased to hear about the telehealth. I was pleased to hear about the other things that you're providing, which are all somewhat innovative and very new in the context of our home country. Let's put let's put another wrinkle to this painting. Going forward, what are you hoping to accomplish, say, in the next 2 or 3 years?
Thank you very much. Thank you. That this question is very, very important to me. We we want to continue to improve on the current services that we have. We are teaching our staff what we call values in practice. We want them to understand that what you do, you should do it well. Do it so well that when somebody sees you do it, they'll want to come back and see you do it again. That comes from Walt Disney. That's the very first thing. Just like you said at the beginning, many people go back to start a project, but they don't take time to really dot all the T's and to be specific. We are very rigorous in our approach. We are looking forward to have our Grace Garden Network Center. We're talking about information technology, which is the way to go. Of course, our cervical cancer program is using artificial intelligence. As we move forward, that is very huge. We are building our training center. Grace Garden wants to be that center of excellence, and by the end of 2024, this network center will have our main auditorium for education, for teaching, for simulation. You cannot grow without the human resource. You cannot grow without the right training. I'm an expert in strategic leadership with specification and succession planning. We want to make sure we institute that health academy at Grace Gardens. We have partners all over the world that would love to contribute, and we believe that the only way we can grow through sustainability is through training. We want to make sure that we can pass on that knowledge. So that is the first step, what we're going to do moving in 2024, the Grace Garden Network Center, which will be focused in training, artificial intelligence simulation. Of course, I know, and knowing you for the past months, I know you have experience as a firefighter. You understand what I mean by simulation. You have to train workers and have them understand we're far away from that. Now we are leading, especially in emergency response. We want to develop our emergency response team so that somebody who called from a village, our response team can be on the ground, just like you do in the developed world. That is on number one on our row, on our project for next year, to have as many motorcycles. If you are hearing out there and you want to sponsor us, please, we know what we call medicine without borders. They come and they go. But how can we start from DUP and move it to Batibu, move it to all the 7 divisions of the Northwest region, and then beyond the Northwest to other places where Cameroonians have what you call an example of a 911 system. When you call, you actually have somebody that will come to your assistance. That is our goal. That is our vision for 2021. And we believe that with your support out there, if you are listening to us, we have been to Harvard to present this project. We are looking for partners. Grace Gardens Hospital is not a clinic, it is a hospital. And if you want to join us for us to develop other departments, I am an expert in cardiology. That is the next project that is in line. We don't have a rehabilitation system in Cameroon. So what about that? That is in line as we look forward. So we are looking and we want to continue to be the leader in building healthcare community. And we're calling on all well wishers and those that want to come together for us to make a difference. Please join us.
Thank you for making that very clear call. And many of those points struck a chord with me, especially when you talk about the bikes, fast response bikes, or whatever you call them. But from my firefighting days, when I was in charge of a fire station with at least 4 bikes at my fire station or at a satellite fire station, their goal was to make a quick response even before the ambulance gets there. The ambulance will be on its way, but the bikers can easily manipulate through traffic. Now, we may not have an issue of traffic in DOP per se, but there are some parts of the village where the fire bikers can reach that even if you had a modern day ambulance, may not be able to make its way there. That could make a significant difference. You're talking about a golden hour of survival. The other thing that I want to check in very quickly with you is who are your partners? Who are the partners that you envision growing with the next couple of years?
Thank you very much. Thank you. I want to appreciate that you asking that question and also to appreciate you. I am with you doing this interview. I've known you for a short time, and I want to say you are really a brother who, when you see something good, you appreciate it right away. Why am I saying this? Us as Africans, we have a challenge to develop. We see people like Dangote who is dominating everywhere. We can talk about it, but we are not really doing anything. I want to first of all start by challenging that. Can we come together before I can appreciate my partners that we're working together? What you and we are doing here, this is a blessing. And as I will continue, I know we have those Pan-Africanisms who are out there, but let's start with the simple thing. We started simple. We had many people a few who supported us. We have MAP International. It is based in the United States in North Carolina. We've been working with them, helping us with medications at a very low cost. We have Project Cure. They have been very helpful in terms of medical supply. We do have Global Bridge Pharmaceutical in North Carolina with Dr. Eric Nietzsche. We have my local church in Dallas, in Dallas, in a small city where you and I, we are in Faith, Texas, Church of Prayer. I do have mission partners like Bill Ketria, of course, my family, my wife, Imelda Jacket, my father-in-law, Dr. Henry Tangang. I've already mentioned some of our partners uh, who have been working with us. And so back in Cameroon, as I have mentioned, we do have many that have supported us on this journey. And I want to say, I want to thank all those that have supported us. Um, it's been a tough road. But like I said, those few partners, they have been very helpful to us. And we continue to look for many. Currently, we formed a small group of three. We have Gilga Prayer and Praise Ministry based in Houston, headed by Dr. Solange Gabis and Dr. Rachel Tita, and Potawira International, headed by Dr. Anne Alanis, who is a gynecologist in Houston, and she's originally from Malawi, doing fantastic work there. Uh, it was really a pleasure having you. We are seeing your skills, Dr. Gideon Fomukwe. Your service to us during that event was really magnificent. You were the special master of ceremony for that event, and that was really so dear, and I'm so grateful for that. Thank you very much.
Thank you for mentioning that. And that was going to be my comment that it takes two to tango. It takes two bangles to make a jingle. And I was privileged to be the fly on the wall to observe you and Gigal Ministries and Pothawira over the weekend. It was a pleasure for me. Yes, I drove down to Houston, but the most important thing was I didn't just drive down to Houston to waste my time. I came there to witness true unsung heroes who are moving the needle in a positive direction. There is a lot of distractions. There are a lot of distractions in America, but I choose to align with folks like you, the Dr. Anne Analysis of the world, the Dr. Solange Gabris, and the Dr. Uh, Rachel Titas of the world, because what you're doing is amazing work, is phenomenal work that very few can do. It takes a lot of courage, it takes a lot of clear thinking, it takes a lot of determination to get that kind of work done. So for me, that was the easier part. What I was doing is much easier compared to the rains, the storms, the turmoil, and all the challenges of you going on medical missions. So I want to applaud you. I witnessed that and I came home with a lot of inspiration for me and my wife, Dr. Pam Fomukwai, to do some other areas of work or maybe look for collaborations. And in this last phase, which I believe is just going to be shorter questions, shorter answers, I want to just first of all say thank you for finding the time. This final phase, let's keep it as short as we can, as funny, as goofy, as whimsical, as quirky as possible, so that when the Gen Ys and the Zillennials see it, they will find it interesting and they will share it. So, Dr. Samuel DeJanket, absolute pleasure to have you afternoon. It's daytime. I'm wondering why you're not at the clinic. You're a clinician. Why don't you introduce us? Tell us about yourself professionally.
Oh, thank you, my brother. You can see I am wearing this shirt with Faith Gardens Medical Foundation International. Uh, that is our foundation. Many people ask me when do you sleep. Today is my day to work at Grace Garden Hospital in Dub via Zoom, and also because I made an appointment to be with you, so my calendar is always full. So I had a time with them going over orientation of new staff, talking about organizational values with them. And so my day is so charged. I work in cardiology at the University Southwestern Medical Center, Dallas, in collaboration with Children's Medical Center, Dallas. That is my day job uh, in the cardiac catheterization lab. So I see patients there for pre and post procedures. And then when I am not there at work, I am on the phone. By the way, one of the things that I do, I am the CEO of Grace Gardens Hospital. I have told many friends that when you build, the challenges we have back home is management. That's why I mentioned my managerial skills. So I basically run the organization. I do rounds with them in the morning. When I am driving to work, that is the time where on my Bluetooth, I am having a huddle meeting with my team on the ground and how the day will go. And so then when I'm coming back, I am getting debriefing from my chief operation officer and my marketing officer. So I run the organization from here. And the world is so small now, you don't have to be down. So everything that goes up on at Grace Garden, it has to pass through my office. I do have a chief of staff in the CEO office who receive all information coming to my office and relate it to me. There's an operation officer and a business manager. And then we also have our coordinator, our administrative coordinator. So we have chief operation officer, business director, marketing director, patient experience officer, and the Grace Garden coordinator. All these five, they work with me every day. And I've made sure in this world of technology, they all have cell phones that have Wi-Fi. So there is no reason for me to call. Yes.
So that tells me you've taken
I,
Western standards all the
I do have.
way into the heart of Bangolan. I could not applaud you more. But I wanted to keep this a little bit on a lighter mood. I didn't even know that Faith Garden has such a fine shirt with such a fine grief. So, can I assume that all partners, all friends, well wishers, both at home and abroad, they have samples of that shirt?
Yes, yes, definitely. I will make sure you get one with our special logo, looking at the organization. So, yes, thank you very much. Thank you.
Okay, okay, that was meant to be in a lighter mood. But tell us, very briefly, the first medical mission. What did you smell on the ground? What did you see on the ground that moved you to the point of deciding to build a hospital in the heart of Ndop in Northwest Province? I prefer to call it province, not state or region, because that's how I grew up. I knew it as a province. What in the first mission inspired you to say, going on mission is not enough? I gotta have a place, a brick and mortar site where people can come and see the doctor.
Thank you very much. The first thing that I saw misery. That's number one. Number two, I was thinking of some kind of complex illnesses, but I found out our people lack basic pain medication. They lack basic medication to clean wounds. I saw people with wounds and maggots. You will not believe it. They tie it with this white. And then when we cleaned those wounds and we were at the park in a car, and this strange person came to us and said, now that you people are going, who is going to take care of us? That I can still, that message is still like resonating up to today. And to add, my mother, who really, I visited her, and all her friends came and they lined up in front of her house with a little notebook in their hands, and they wanted to see that big doctor, as they call it, who came from the United States. And she told me, if you help my people, I am going to get well.
Mm.
That
Now,
is the message.
as a professional storyteller, that was the inciting incident. That was a moment you had to become a story warrior. This is a story warrior channel. That's the moment I was looking for because that's when you found the world so broken that something surged in you. You said, I'm going to fix this broken world. Yes, going on the first medical mission was important, but that moment when that guy asked you, when you are gone, who will take care of us? That moment when those women, your mother's friends, came to you asking to see you, those were the moments you were commissioned. And I now see why you are unstoppable. You are definitely unstoppable because that moment is etched in your memory. You can never forget that. But that's a story for another day. We'll tell that story some other day. But tell me, when you went on the first medical mission and came back, you were resolved to do something about it, started to implement, started to execute. How did you work through the complex network of government authorities that we know in Africa? They are a subject of their own. How did you break through all of that? Because a million other people have tried and failed.
Oh my God. I mean, my brother, Dr. Gideon, I I believe my gray hair is from going through that process. There were moments I almost gave up, and my faith in God told me to continue. And like I said, I was blessed with two powerful women, Madame uh, Patricia Nava and Dr. Manjo Matilda. I don't know, these two women, God brought them on our path. When at some point we almost gave up, I want to be honest. I have told the Minister of Public Health, it is tough to get this process. And this current minister has recognized it from our story, and he is doing something. And I want to appreciate that they are still, many of our leaders back home, they do listen. But yes, it is tough and challenging, very, very tough. Nobody cares what you are doing, whether you are going to help people. But from the process in 2015, I want to remember Dr. Bambo Emmanuel of blessed memory, uh, George Tebo, who were there at that onset beginning to help with the paperwork, right to the current uh, delegate of public health, and of course the governor. We had to knock all doors. Like you would say, there was one time I found myself the only one outside in Bamenda with nobody, and it was a curfew time. And I didn't know that I was going to survive. So I have been through situation where I'm driving and my car is the only car that is going and no car is coming. So yes, it's a mission of faith. As you say, it's a mission of faith.
Thank you so much. I've heard you say it before that it's faith that got you through some of those difficult moments. And I know without a shadow of doubt that it took a lot of perseverance. Now you can look and say, you know what? We got something on the ground. Let me ask you a very quick one. Is Faith Garden or Grace Garden now financially sustaining?
Yes. In a nutshell, let me explain. This is very important to encourage our brothers and sisters who are going back, who want to go do something. We started very small. So the current structure, the primary care center and the surgical center is sustainable, meaning that they can pay their staff and they can take care of expenses. But we are far, far, far from where we want to be. So if you want to start a project back, start it small. We started with 9 staff, and I just told you we're at 55 staff. 3 doctors. There is no structure in DOP or in any district with 2 doctors. We have 3 doctors. And we are being told that we are just going above our head. So we are sustainable, we're able to pay our staff, and because we have a strict managerial system in place.
Yes. That must be a testament to your managerial skills, leadership skills. Uh, in most of NDOP, is this district hospital still operational or not? No, we have to end in about a minute or two.
Yes, the district hospital in Dub is operational. We also have another private hospital, St. John Hospital. There is also integrated health center. Yes.
But I understand probably during the peak of the civil war or the crisis or conflict or whatever they call it, most of the other hospitals were not operational, and Grace Garden was probably the only one that was operational. Is that true, sir?
So Grace Garden has been fully operational, and we are at the heart of the crisis. And I would say there have been times where things are tough, people will not even come out. But of course, Grace Garden has been the light in that area.
Thank you so much. I think we end on that note that when you see darkness and you're committed to lighting a spark, never know how many people is served by that spark of light. I believe that Grace Gas is that spark that is not only serving the community in Ngoketunjia division, but the larger Northwest and the rest of Cameroon, because as a center of excellence in cervical cancer and many other areas, surely someday that would inspire other people in the diaspora to go and plant a seed and work hard in nurturing it with the hope that someday will provide a light of touch. Thank you so much, Dr. Ijankad, and all your team. Pray for you and hope that the Lord will continue to guide you forward.
Thank you very much. The blessing is mine, the pleasure is mine. May God bless you with what you do. Thank you.
Thank you so much.
Bye.
Ovawans, Story Warrior, thank you so much for watching. I hope you take some lessons away from this conversation. But it's not about just a lesson, it's about what you do with it. Thank you so much and have a great day. Doc?